Bowel cancer is the name that's usually applied to a cancerous or malignant process that affects the lower part of the bowel, and we call that the colon or the rectum, which is the very end of the bowel. It's a cancerous process that can show itself or present with a number of symptoms. Bowel cancer can cause bleeding from the back passage. The type of blood that patients report can vary depending on where within the bowel the cancer forms, but so it can be bright red blood that's noticed on wiping at the back passage. But if the bowel cancer forms in a part of the bowel further away from the back passage, the blood can often change so that as it emerges from the back passage it's darker red, purple, possibly even very dark, possibly even black, and it can mix in the middle of the stool. The other common symptom of bowel cancer is a change in the bowel habit. And you can have two main types of change in your bowel habit. You can have diarrhea, where the patient goes to the toilet more frequently than they would do normally, or it's a looser consistency, or you could have a constipation in which the patient would go less frequently and it's a harder consistency. I think it's fair to say that the more concerning symptom is diarrhea. That's more typically associated with a significant problem such as bowel cancer or bowel inflammation. Constipation can be associated with bowel cancer, but can also be increasingly associated with a much wider range of things such as dietary changes or medication changes or other medical conditions such as thyroid disease. If you do have a change in your bowel habit or rectal bleeding, then it's important to report that to a doctor. There are other symptoms that can be associated with bowel cancer, such as abdominal pain, loss of weight, or if your blood level drops, and we call that anemia. The way that we would investigate those symptoms is usually by means of a camera test of the bowel. We call that a colonoscopy, and that's the most sort of accurate way really of assessing the whole bowel, determining if there is anything of concern, and if so we can take some samples from the area of the bowel of interest, and then we could analyse those down the microscope. If you have any rectal bleeding or persisting change in your bowel habit, it is important to report that to your GP or come for a consultation here at OSD Healthcare.